Now, without any further ado, presentation and an introduction with a presentation on healthcare in crisis situations with Frédéric de Saint Sernin, chairman of an NGO and also administrator of the Pierre Fabre Foundation. Ladies and gentlemen, I'm delighted to take part in this discussion. I'm the chairman of the main international solidarity NGO, and so we do everything which is not medical, and therefore I believe it is important for me to maybe tell you more about what we do in a crisis. A few figures maybe before we start. 300 million people in the world have emergency humanitarian needs to survive. These figures are increasing between 2019 and 2022. We saw a very substantial progression of in the number of people facing severe nutritional needs. Over the last 10 years, we have 2 times more people who are displaced or refugees, and they also need help. And we, as NGO, we face many challenges. I'd like to mention 8. The first and main challenge, of course, is the financial challenge. You probably understood this. Faced with increasing needs, and public health for development is a major issue. Of course, I won't mention private funding, but public funding, which supports international organizations such as ours. So we need more and more when the financial situation is worsening. The UN last year, in 2024, considered that we would need $500 billion in order to face the needs of the needy in the world. $500 billion last year in 2024. 43% of these needs were met only. At half of this year, 2025, we've only had half of the needs, the means required to ensure that we may do something. So a lot of money is missing, and of course everyone has in mind what's happening in the US. The fact that the USAID agency reduced, stopped, or even suspended its programs means that 83% of American funding is missing to support international organizations on the field. The Americans represent 40% of humanitarian aid in the world, and so of course we see what's missing. We could have hoped that other countries take action. The Chinese had announced that they would be supporting the World Health Organization, but they didn't, and we see in our discussions that we may have with major countries from the Gulf that they sometimes commit to humanitarian actions, but in very specific circumstances. So the governments are not here to face these needs. In Europe, we can see minus 20% from the UK, minus 20% from Norwegians, minus 15% from the French, and I can tell you that the trend will be more and more negative. So more and more needs and less public funding. So this is the major financial challenge we're facing. In a nutshell, and very briefly, the funding of organizations such as ours, it's in euros and dollars, and the conversion rate is such that for a year such as 2024, an organization such as Acted will have to spend between 2 and 3 million euros. So the financial challenge is a major challenge, and I would like to add that crises are of interest for those who fund humanitarian aid. We saw this with the Ukrainian crisis in 2022. Many entities took action, and we, who are the biggest ONG in the Ukraine, I can tell you that we've never missed funding. In fact, sometimes we've had too much, but there are these silent crises, and for these silent crises, we are sometimes helpless. In Somalia, the funding was frozen by the donors when it had been decided, and all this money was then sent to the Ukraine. So this dimension is such that we are sometimes faced with very difficult choices. And we need to bear in mind that there are crises And these crises, of course, sometimes gain media interest and coverage and are funded, and others are silent crises. Last financial aspect, we are more and more mobilized when there's an emergency, climate disaster. We make sure that we support such and such a program. It is much more difficult to then have long-lasting support when it comes to rebuilding or finish our programs. So the first challenge is the financial challenge, then logistics are try and speed up for the other challenges. The logistics question, we are in a period of climate disaster, the roads are cut, the bridges are destroyed, airports are also overwhelmed and so you see this organization is necessary and it has to be understood. And although we know the context of a country very well when we operate in it, when a climate disaster happens, everything changes. When a war arrives or a conflict occurs, in terms of logistics, we are faced with a different reality. In South Sudan, we were working in an area that was controlled by the Khartoum authorities, which are not in Khartoum really anymore, but in Port Sudan. This territory was then occupied by the opponents of RSF, and so we had funding, we could work, we had identified beneficiaries, but we couldn't work anymore. And so logistics are a true reality and a dire reality at times for NGOs. Security. 20, 25 years ago, NGOs were respected, they were well treated, and some 10 years ago, we could be indirect targets. Now we are targeted directly. 385 casualties for humanitarians, over 300 wounded, 125 kidnapped, 45 are still in prison. In Gaza, we lost 2 employees, and in 2025 we had lost another 2. And they had been deliberately targeted during food distribution. This is a reality that we are now facing that we were not facing years ago. Political issues. We work in countries where we are registered. In other words, we are identified by public authorities managing the country. However, despite this fact, we can sometimes be faced with the problem of corruption. We can sometimes face misunderstandings in order to reach out to such and such a beneficiary, and therefore it's always very important to remain in touch with these entities. But whether for visas, if we want to get people coming in, or specialists coming in from abroad, or whether we want the right Ausweis to reach a certain territory, it's a permanent conflict with the public authorities, which can sometimes have us kicked out. We were kicked out from Nigeria because there were difficulties with a governor in an area of the country, so we had to leave, and we were just
Défi écologique, c'est un élément très important qu'il faut avoir à l'esprit parce que quand on intervient, il y a des avions, il y a des camions.
There are aircraft, there are trucks, and we need to adapt sometimes to circumstances. I was in Burma not so long ago, and we remember a program that we had set up over there to reach the people. We had to buy some 200 donkeys, but we have yes, aircraft, we have trucks, but all NGOs have programs to reduce their carbon footprint, and therefore we are an NGO. At the beginning, we were working on humanitarian nexus, emergencies, rebuilding and development. We are now very present on working on environmental programs, replanting forests in certain areas. The challenge of coordination is an extremely important one. We don't mention this enough, but when we are in a war period, when we are on a climate crisis, sometimes there are too many NGOs. When there's an earthquake, this was the case in Nepal a few years ago, we need medical organizations to save lives. We need fire brigades with dogs in order to save lives as people are extracted from rubble. It is important for you to know that
coordination,
this
cette
coordination,
hiérarchisation des interventions, elle se fait, et elle se fait bien. On n'a pas toujours l'impression que ça
must
se
be
passe comme
done,
ça.
and it's not
Mais
always done in the
souvent,
right way,
grâce
but often,
à OCHA,
thanks
qui est
to
l'organe
OCHA,
de
which
coordination
is the
des Nations Unies,
UN
on arrive à
coordination
bien faire en
entity,
sorte
we
que nous
can
intervenions
ensure
dans
that
la
we
hiérarchie,
operate
dans la
at the right
discipline
level
et dans un cadre
with
qui est suffisamment
discipline
difficile.
and
Et point
in
essentiel aussi de la
difficult
coordination,
circumstances, of course,
être bien
but
présent
other
sur tous
important
les terrains
aspect of
qui
coordination,
nécessitent
we need to be everywhere
d'intervenir
where our
et de
presence
subvenir aux
is
besoins
required
essentiels.
in order to meet essential
Éviter que
needs.
telle région
We
se
need to
trouve
avoid that such a
particulièrement
region will be
soutenue alors que d'autres
extremely well supported when
n'en est
others will not
le
be
défi
supported.
du personnel. Une organisation
Other
humanitaire,
challenge,
quelle qu'elle soit,
staff.
c'est du
An
personnel. Nous
NGO
avons 5
means
000 employés.
staff. We have 5,000 members of staff. 92-93% are employed nationally, and they live on the field. They live beside the populations that we support, with all the difficulties they may encounter in terms of neighborhood. Notwithstanding the fact that, of course, our employees in Gaza, for instance, live with all people, and they are faced with the situation you all know. So this is very important, and you need to know that we must be extremely close to our staff, provide them with psychological support. There are all kinds of difficulties that their families could be facing in order to ensure that they be as efficient and effective as possible. International employees, we need these international employees, expats who will operate in such and such a specific situation. So we have people who are young, very young, and they must face the challenge of isolation. They'll be working for 15 days, 3 weeks sometimes. I remember one of our young expats for 4 weeks. He slept in his car after an earthquake. So there it is very difficult to work on the field. There's a lot of pressure vis-à-vis the authorities, vis-à-vis the people who are suffering. And so for an organization, for the managers of a humanitarian organization, the challenge of employees is a big and a major issue. And then the last challenge is the ethical challenge. It's very important. We cannot just live telling people how things should be done. There are people on the field organizing political and social life in the different countries. We must comply. We must be consistent with what they do, because we are here. I mean, what we do is good. We are not here to come with something which could be negative, which could be misunderstood. We do not want to create inequalities, and often our funding comes to help people who are refugees. In other words, they left a country for another country, and so we help them, we support them, but this can create, discrepancy or misunderstanding with the host country, as well as who do not benefit from this support. And so, of course, we need to make sure that what we provide is effective and expected by the population without generating misunderstandings and inequalities. Now, in order to mention the more medical operations, we do not do any medical operations, but in a nutshell, last year, since the decrease in funding, the major problem comes from the fact that we do not vaccinate anymore, or less and less, and so we see a certain number of diseases appearing. When these vaccines are not funded anymore, we see these diseases surging again. So we have more and more displaced people and refugees, and therefore these diseases are spreading, and it's more and more difficult to contain them. So this was in a nutshell what I wanted to say. I tried to keep it brief and simple, but what I'd like to say in terms of a conclusion is that we operate. Commitment. Our commitment is important, of course, but this commitment is not only a one shot to meet the needs after an emergency. It must be long-term support with long-term funding in order to provide these populations with the support they need.